Welcome to From the Front Lines, Surgeons' Voices for the American College of Surgeons Bulletin Brief. With me today is Mr. Jeremy Fridling. Jeremy is a fourth-year medical student at the Quinnipiac University Frank H School of Medicine in Connecticut, where he's had the pleasure and privilege to work with my dear friend and co-regent, Dr. Lenworth Jacobs. Dr. Jacobs, of course, having been the driving force behind the Stop the Bleed program, the Hartford Consensus Conference, and many other wonderful accomplishments. Welcome to From the Front Lines, Jeremy.
Thank you for having me.
One of the reasons that I was intrigued to speak to you is to hear about your research, and secondly, the other reason is to hear about your feelings about getting to present at the ACS Annual Clinical Congress as a medical student. So let's first start with how you got interested in pursuing this project and what led you to submit your work to the ACS for consideration for presentation at the Annual Clinical Congress.
So before medical school, I worked as a paramedic, and coming into medical school, being interested in surgery and with trauma, I was looking for a way to do some sort of scholarly work that blended the two. And learning about Stop the Bleed and then connecting with Dr. Jacobs, I quickly realized that it would allow me to use my experience as a paramedic and my new knowledge as a medical student to go out into the community, both at Quinnipiac University and in the surrounding towns, and teach these life-saving skills and interact with the people and hopefully lead to some lives being saved.
And what was your feeling when you found out your work was accepted?
I was thrilled. To me, this is kind of the pinnacle of general surgery research, is being able to present at the American College of Surgeons Clinical Congress. And Dr. Jacobs and I have been working towards this for the last 3 years, trying to figure out the right time for our submission and making sure that our results were ready and were meaningful. So this has definitely been the high point of what has been a 3-year project.
Well, congratulations to you, because you seem to have reached the pinnacle of the pinnacle in that you're also the recipient of the American College of Surgeons Excellence in Research Award, which is a wonderful, wonderful accomplishment for a fourth-year medical student, which begs the question, what is the research that led to this award?
Sure, thank you. Very excited, very happy to be receiving the award. The research that we did was focusing on the American College of Surgeons Bleeding Control Basic class. And so what we did is we went in Quinnipiac, the surrounding towns, across Connecticut, and then even down into Maryland, where I'm from, and Washington, D.C., and we taught the class. So in 2018, we taught the class to more than 1,000 participants, people who were first responders, people who worked in healthcare, and people with no healthcare experience or prior hemorrhage control training at all. And we asked the question, is the Bleeding Control Basic course effective in teaching members of the public of any age, gender, occupation, and level of training? Is it effective in teaching them to stop hemorrhage? And is it effective in empowering them to do so successfully? And so we used surveys before the class, after the class, and then 6 and 12 months later to measure things like willingness to apply the hemorrhage control skills, belief in ability to save a life, confidence in the knowledge and skills learned, and then whether or not they would recommend the class to other people. And what sets our project apart from many of the other studies on the Bleeding Control Basic course is that we also measured skill usage. So we wanted to know if people who were taking this course with any kind of training beforehand and any age and occupation again, whether or not they were actually using it. So it was all great if this class it teaches people to do all these things, but the question is it working? And what we found is that in 31 of the 370 or so people who responded to our follow-up surveys, 31 people actually used these skills on a live person within 1 year of the class. And that 31 includes 7 people who are not first responders and do not work in healthcare, and 8 people who had no previous training. And of the 31, 29 were successful in stopping the bleed. In 29 of those cases also, the patient made it to the hospital alive. And in every case involving a tourniquet or a wound packing, which was 16 in total, the outcome was successful. And in all 8 people who were previously untrained, when they applied their intervention, it was also successful.
Well, congratulations. That's quite an outstanding result and impressive testimony to the ability of this program to train people to actually stop the bleeding and save lives. Perhaps you could give us the last question I'll ask you is perhaps you could give us a context for the 29 out of 31. I know in your poster you relay what that number is as a baseline in terms of how many people who sustain a trauma will hemorrhage, will not make it to a hospital, just so people can appreciate. People like me are not trauma surgeons, colorectal surgeon, ENT, orthopedist. What is the standard number had these people not been trained?
So I'll go beyond the surgeons and I'll go for the general public. So the Hartford Consensus identified that one of the most common causes of preventable death from trauma is exsanguination. And that often occurs before first responders are able to arrive at the scene of the injury. So the goal of this class was to empower members of the public to be immediate responders. And a 2018 study showed that 43% of all deaths from trauma in their population were due to exsanguination and potentially controllable exsanguination in extremity hemorrhage. So the Stop the Bleed class, the goal is to create these immediate responders, members of the public who can stop extremity hemorrhage and prevent potentially 43% of deaths from trauma. And trauma is the leading cause of death in those aged 1 to 44, according to the CDC. So we're talking a large percentage of a large number of deaths that can potentially be prevented by participants of the bleeding control class.
Congratulations. It seems that you've very successfully proven your point that instead of 43%, 29 of 31 were successful in this instance. The program is certainly scalable, translatable. We know that. You're very fortunate to have had a superlative mentor, one of the most capable, energetic, and insightful trauma surgeons, or any type of surgeon, quite honestly, that I've ever met, Dr. Len Jacobs. That's been wonderful. I hope you're as successful in finding a mentor after you match in your general surgery program who can keep your energy and your enthusiasm going for investigation. You've done a great job to start as a medical student.
Thank you. Thank you very much. I've had an amazing experience working with Dr. Jacobs. Certainly wouldn't be at this point without him.
Well, I wish you well, and I look forward to hearing your presentation at the virtual clinical congress.
Thank you. Thank you again for having me.